The patient journey. So first of all, they'll access the Engage Consult link through your website. This will bring them to the patient portal with various buttons that you can choose from, and they can click Consult Now to get help from the surgery. It will ask them to continue as a guest user or log into their account. Administrative query. They need to select who they need to access the service for, so it could be themselves or if they have any dependents. Select what they need help with today, so we're going to request help from surgery. They need to read and confirm that if it's an emergency they would call 999 and not use this service. Confirm their mobile number is correct. And we're going to select administrative query here for the request type. And we don't mind help from anyone. And what can they help us with today? So we're going to select prescription request. Type in any information that's going to help the doctor or the clinical team member. Upload any files that may be relevant or necessary as long as they're to the guidelines. And they can download a report of their request. Here they type in their telephone number again, any information that would be useful, and that shows the hours for this service. So once they've sent that, they get a chance to fill in a feedback survey, or they can select not this time, a medical query. So again, we choose who we're accessing the service for, requesting help from the surgery, confirming we understand, confirming our mobile number, selecting a medical problem, who we would like help from, and if we need to tell them our availability. So we're going to just pop in here when we're available to take a call. You can show the service hours for the service and continue through, and then select what kind of problem it is. So when you type in here what your problem is, for example back pain, you select add problem and if there's any other symptoms you may have. Here it takes you to an NHS link. So this is if they needed self-help in the meantime. When they go back, it says, did you find that information useful and do they still need to contact you? So if they selected no there, the request would no longer go further. They then select continue and upload any files that may be relevant. And consent that their images can be used. Answer some questions around their problem. And they can skip questions if they want to, but we do recommend that they answer as many questions as they can to help you out when you're looking at their requests. So once they've finished the request, they will get an overview of what they have inputted. They can write a little message, download the report for themselves or accept and continue, confirm their telephone number is correct and any information that may help you when you need to contact them, and shows them the hours for the service. And again, they can submit a feedback form if they want to. Receiving a message from the practice. So this then appears at the top of the toolbar. They can see the message that has been sent to them and reply back. But they can only reply back once the practice has messaged them, and they can see all their previous messages as well. Submitting a request outside of service hours. So when the patient goes in to request help from surgery, it will tell them that requests are not being accepted and when the hours for this service are. So this is set by the practice. This is how they manage their demand. And the patient knows when they can go in to submit a request. However, surgeries can have it so that patients can submit requests outside of the service hours. If so, it will just confirm with the patient when the service hours are and that they are going to be submitting a request outside of the service hours, so it will take longer to get back to them. But they can personalise these messages to the patient so they understand when they will get a reply back.